Joining me now to discuss it is an outspoken critic of the WHO proposal, Congressman Chris Smith. He serves on the House Foreign Affairs Committee, where he's the senior member and the ranking member of the House Global Health Subcommittee. He represents New Jersey's 4th District. Congressman Smith, welcome back to Washington Watch.
Joseph, thank you very much for having me on. Really appreciate it. Thank you.
So tell us, how concerned should we be about this proposed rule change in the World Health Organization?
We should be deeply concerned. You know, the 2005 International Health Regulations had a balance where a declaration could be made, but only in concurrence with the country, like the United States, where the alleged health concern is manifesting. Biden strikes all of the nation states, and that's not just ourselves, in terms of collaborating with the World Health Organizations, and invests in the Director General all of that power. And regional directors would have incredible power as well to make these calls. Secondly, when it comes to the response, again, the countries are taken out of it. Matter of fact, if they don't agree with what WHO is mandating that they do, they have 48 hours to issue a response, and it's not clear what the penalties will be. And this really is a template, as you kind of alluded to a treaty that would have even more enforcement capability to tell us and other countries that our sovereignty does not matter, that WHO and a few bureaucrats know it all. And, you know, Tedros, who is the Director General, I've known him for years. He was the health minister for Ethiopia and the foreign minister. He covered up some health crises that occurred in Ethiopia. And most brazenly of all, because he got his job because the Chinese Communist Party helped him get the job at the WHO. He's about to be reelected with no opposition in his upcoming meeting for another 5-year term. Again, the Chinese have led on this. But look what he did with COVID. He said, I will praise the Chinese in the early days for their great response. The actual quote is even worse. And he just parroted what Xi Jinping and the Chinese Communist Party wanted him to say in the big cover-up. And we still don't know from the WHO and from him the origins. We all believe, and I believe it strongly, it came out of a lab. But, you know, where is WHO absolutely insisting that data be provided? There has been a massive cover-up. And that portends and the harbinger of other mischief that could really inure against us in the United States. I'm all for crises management and making sure that we mitigate horrible diseases. I work on those things all the time, Joseph, all the time, whether it be HIV/AIDS, malaria, all these issues that manifest in other countries, Ebola. But frankly, we should not lose our sovereignty. The balance that was found in the 2015 regulations ought to be kept intact. Biden is scrapping the countries having that collaboration, and they will be told what to do, and they will not be partners anymore.
Congressman Smith, the response to these proposals in the U.S. is gathering. We're going to get to those in a moment.
Yes.
But I want to try to bottom line this, if I can, with you, because some of the criticism that we've seen about these proposed rules is that we would be giving the World Health Organization the authority to impose lockdowns on the United States. Is that an overstatement?
Well, it's unclear what the response will be from WHO given any crisis that might be out there. But it's unclear. You know, ambiguity is not a good thing when you're writing regulations and when you're writing treaties. We need specifics. What power do they have and don't they have? And again, the current regulations that Biden will be scrapping and throwing under the bus give the countries the ability to be partners, to collaborate with the WHO. In addition to this, there's also a big push to give more power to Tedros, the Director General, over all of the money in WHO. Right now, he has power over the assessed contribution, which is about 20% of their budget. We provide a lot of money in what they call voluntary contributions. He wants that too. You know, an unelected bureaucrat that has a very, very questionable record, especially given how he got his job in the first place, courtesy of Xi Jinping and the Chinese Communist Party, and the massive cover-up that we saw take place, particularly in the early days and weeks of the pandemic. You know, and why isn't he also saying we need to let Taiwan in? Taiwan were the ones and the government there that pointed out the problems in the early days of the pandemic. They're excluded. Why? Because the Chinese Communist Party in Beijing wants them excluded. So he will do what Xi Jinping wants him to do. And I think that's very dangerous for America. Sovereignty matters. Our health experts, we believe, local and federal, of course, they're not, they do make mistakes at times. I'd rather have that local control rather than ceding it to the World Health Organization and an unelected bureaucrat with such a checkered record.
Well, and that is one of the principles of limited government, is that the decision can be made most closely to the people affected by the decision.
Exactly.
And this step would obviously go in the opposite direction. If anything, in response to what happened with COVID, there seems to be a desire to have those decisions not made even by the governor or by the White House, but locally, so they can take into account the things that are happening in a community, in a city. Because nobody wants everybody to get sick and die, but there's this growing awareness that decisions, that the factors change from town to town, zip code to zip code. And the idea that it would go even more global rather than more local is concerning. But there is pushback.
Joseph, Tedros got it wrong. He got it horribly wrong. And many people died because he got it wrong. He took the Chinese Communist Party's mantra that you don't have human-to-human transmission. That was totally untrue. And that went on for weeks. He made serious mistakes. Now, I would rather that we have that local control, like you said, and partner with them if that need be, but don't give up our sovereignty, particularly when the health and well-being of Americans are at risk. And so, the malign influence of the Chinese Communist Party continues for the next 5 years when he is reelected.
As the conversations in Geneva are being prepared for next week, some breaking news this afternoon. Senators Cotton and Dane have written a letter to the White House urging them to withdraw entirely from the World Health Organization. Clearly, some battle lines, politically speaking, are being drawn. How do you see this playing out?
Well, I think for once it's getting some scrutiny. The Biden administration does a lot of things in secret with executive orders that few people see until they're actually announced. The European Council has just a few weeks ago called for a new treaty, a binding treaty. And of course, the WHO is working on a draft on that as well. So what happens next week could become the template for a brand new binding treaty that grossly undermines the United States sovereignty. Sovereignty matters. We need to be able to make our decisions about our health crises. We have great experts that all of a sudden will be cowering to whatever it is that WHO has to say. And if they hadn't gotten it so wrong on COVID and continue to obstruct an honest assessment about its origins, they might be given it even more of a little bit of leeway, but that wasn't the case. And again, Tedros, I know him. Here's a guy, WHO is branching out into a lot of other areas, Joseph, as you probably know. They have become a prime promoter of abortion on demand. Then they even, on their website even, talk about how the pandemic has become, a conduit towards the promotion of abortion. Are you kidding me? The WHO should be standing with life. And for many years, they were at least neutral on the issue, believing that that's up to sovereign states to decide. But now
Congressman, we've got about a minute left, but I want to get in one other question if I can on this. Why would the Biden administration want to give greater authority over the United States to the World Health Organization? From their perspective, what benefit do the American people get?
It's a great question. You should ask them. Everyone should ask them why ceding authority to unelected bureaucrats who got it horribly wrong on COVID-19 should then become the masters of our planning and our responses to. I mean, nobody responds better than the United States of America to crises, including things like Ebola. I chaired a number of hearings on Ebola when that was manifesting in Africa, in many places, over many times. Yeah, WHO was there, but the U.S. government played the key role in mitigating and helping to save lives. So, don't just give all this authority to people, again, who are not accountable. I find in all things, government, bureaucrat, you got to have accountability. Where's the accountability when we disagree? They'll
We
say,
agree, Congressman Smith. We do need accountability to the people. We are out of time. We appreciate your time. Thanks so much for being with us today.
Joseph, thank you for having me on. Appreciate it.